History is being made right here in Cleveland with a first-of-its-kind stroke treatment. In December of last year, a device was implanted into a stroke victim's brain at Cleveland Clinic. We were the only TV station there in April when it was turned on. And today, Judy Slater is not just making remarkable progress, she is paving the way for future stroke victims.
It was scary, and you wondered if you'd ever get better again.
It was Memorial Day weekend 2 years ago. Judy Slater was with her grandkids at her home here in Pulaski, Pennsylvania when she took a fall. It turns out she'd suffered a stroke.
I couldn't get my own food. I couldn't do anything. I couldn't get dressed. I couldn't bathe myself. I had to learn how to walk. I had to learn how to do everything again.
Simple, everyday tasks most of us take for granted. During her physical therapy, which is standard treatment for stroke, Judy was asked if she'd be interested in something a little more revolutionary.
What we have been trying to find are treatments that can boost the effects of therapy, that can take therapy results to a new level.
That is the idea behind deep brain stimulation. Think of it as a pacemaker, but for the brain.
Deep brain stimulation has a battery that goes under the skin of the chest, but the wire is really connected to the brain so that we can use small electrical pulses to control a little bit of the brain activity.
It's something that's done all the time to treat Parkinson's, so doctors thought, why not stroke? But the question Judy had to ask herself, would she say yes to being the first patient in the world to try it?
I didn't really have anything to lose. I could move anyway, could take the chance.
Morning, Judy. How are you doing?
Morning.
We first met Judy in April when her device was turned on. In the time since, she's continued to reach milestones.
Last year at this time, I couldn't even move.
But the process hasn't been easy. Even with the device, Judy still has to put in work. She goes to physical therapy twice a week and does exercises on her own every day.
Some days you wake up and you don't feel like doing anything, but you got to do it every day.
And it's paying off.
My arm was like this. I was all curled up. My fingers were curled up, and you walked around like this all the time. You haven't moved for 2 years, and you think, oh. Then you look at your fingers now.
Even her doctors say Judy's progress is beyond their expectations, which is encouraging for future patients.
We want to promise hope. I think what this tells us is that it is possible.
A second patient recently went through the same surgery and is also doing really well. Cleveland Clinic is still enrolling additional patients. Now, Dr. Machado tells me what's most encouraging about Judy's progress is not only how far she's come, it's that she's still continuing to get better. I mean, Rob, they initially thought she would have improved as much as she could within 4 months. She proved them wrong.
It's an amazing story. I would imagine with something like this, finding the right person to take that first step, both literally and figuratively, is tough. But
scary
they found
to do.
the right person in Judy, didn't they?
She's great. Absolutely. Wish her the best.